Welcome to the 2008 Breeders' Education Committee panel discussion on the breeding of Newfoundlands, and featuring 5 top breeders of ROM Newfoundlands, entitled "You've Met Them in Print, Now Meet Them in Person." And our panel is Peggy Helming, Kathy Griffin, Suzanne Jones, Marg Wilmont, I'm just giving you a special invitation, Betty. Okay, and Betty McDonnell. Okay, I'm Fred Bock. I'm the moderator of the discussion. I'm going to be assisted by Ron Horn. Now, before we get started, I want to thank the NCA Board of Directors and the Newfoundland Club of New England for making this event possible. Also, the NCA Breeders' Education Committee. This event, which is chaired by Kathy McIver, and it's been Kathy McIver's vision to have sharing and mentoring by top breeders, and it's being realized tonight, and we appreciate her commitment and her dedication to the issue. The other committee members who have contributed to this event, in no particular order, are Jeannie McAdams, Suzanne Jones, Pat Randall, John Cornell, Pam Rubio, Janice Anderson, and finally Karen Bach, who is the committee coordinator for this event. All right. Now, a few ground rules for what's going to happen tonight, this discussion. I'm going to start with some questions that the committee received before the show started this evening. Each panel member will have up to 2 minutes for an initial response to any question. Okay, after everybody's had a chance to answer, I will ask the panel if anyone wants to expand on her answers or has more information. We'll rotate the initial question down the panel. So whoever answers the first question to your right, you're going to get the next question, just so you're prepared. Okay. At some point, I plan to open the discussion to questions from the floor, and I do have a request, and that is that you limit the length of your questions to the panel from the floor to 1 minute. And you'll notice that the questions that I'll be asking are probably about 25 or 30 seconds, which may or may not make them clear to the panel. All right, so what that will do is allow us to have as many questions from the audience as possible. Okay, Ron, oh, there he is. Ron has a wireless mic, and when we're ready for questions from the floor, why Ron will circulate and bring a microphone to you so that we can make sure everybody gets heard. Two more things actually. As you see, this is being videotaped, and you received a form to order a video in your package. If you don't have it or lost it or used it to make paper airplanes, we have a few extra copies at the back of the room. And finally, my plan is to stop at 10 p.m. no matter what. We've all been up early the last 2 days working. We're going to be up late tonight. We're going to be up early tomorrow, and we work hard, and so we'll quit at that time. Now, Ron, the first question, please. No, I get to read it. Well, you are dulcet. Sit down here with me. Hold my hand. Well, okay, this isn't the question you told me you were going to give me. All right. Well, I'm sorry, panel. I've been double-crossed by my associate. Okay, you're going to like this question better. Okay, what are the 5 top things you look for when breeding, and what do you think is the order of importance? Peggy?
Okay, are you speaking of an individual dog? What?
Well, you're looking to breed 2 dogs.
2 dogs together. Yeah. Well, first of all, both dogs, in my opinion, the first and foremost thing they should be is a good Newfoundland. Good in breed type, good structure, and good sound movement. If that is all in place, then next I would go and do all the health clearances on both of those animals to be sure that they were healthy enough to be bred. Of course, they must have the appropriate temperament to be bred. And this is where we don't have any numbers to substantiate just how good the temperament is or is not. So I feel it's important to be realistic and not fool ourselves on that particular point, since in our standard is the single most important characteristic of our breed. But there are no numbers for that. Keep that in mind. So it's up to you guys to be honest with yourselves. And then I would like to see the pedigree of the dog and be sure that the basic background on the dog for at least 3 generations supports the quality of both the sire and the potential dam that we're going to have the breeding with. I don't know if that's 5.
That's enough. Leave something for somebody
Shut
else.
up, right?
Okay, Kathy?
I think Peggy said it all. It's whatever, anybody who's considering a breeding has to tick those things off in their mind, and well said.
Okay. Suzanne, you can just say me too.
I would have to agree with that. I think she
Speak
pretty
in.
much covered it. I don't know where I talk.
This is our mics.
Oh, okay.
Can you reach to that one?
I do. I think that and I think she put it pretty much in the right order. First of all, they have to be good Newfoundlands,
Okay.
you know? That has to be first and foremost.
Ladies, we need to use the mic so that he can record it.
I'm kind of reiterating what Peggy
Yeah,
said, and
yeah.
I think she put it in pretty much the right order, and that first and foremost, they have to be good Newfoundlands.
Okay, yeah.
I think they need to complement each other. Pedigrees need to complement each other, and I'm a pedigree person myself, so. But I do think she covered it all.
Okay. Marg,
Anything to add, Mark?
I was just going to say they must
speak into the mic,
they
ladies.
must complement each other, as Sue just said. You cannot breed 2 foals together, no matter how small, or you just want to magnify them. So, and if you can breed 2 dogs together who have many like strengths, you're going to go ahead much faster. So that's something I look for too.
I like the order that Peggy mentioned, and I certainly agree with that. I think with pedigrees, I'm always amazed that a lot of novices come in and they know pedigrees, but they don't really know the dogs behind.
That's right.
And that's one thing that maybe, being old, we've seen these dogs, and we talk among ourselves, and we know what they threw, their faults. We know the strengths, and maybe it's good to be in it a while, or certainly ask people that really knew the dogs, not just the pretty picture you've seen or the wins that he had, because that means nothing in reproducing.
Okay? Anybody want to say anything else? Nope. All right. Here's the one I thought we were going to get, and good luck in terms of figuring out what it is.
Yeah.
All right. I'll read it, and then I'll tell you what I think it is. And Kathy, good luck. Do you think that the sire influences a bitch's reproductive ability and vice versa? And what they really are talking about, do they think that the bitch or the dam influence the fertility of the get? In other words, if you use a sire, is he going to influence the ability of the dam's female get to reproduce? Okay, one more time. I've got my stud dog. I got my brood bitch. Okay, we do the breeding. How much influence does the sire have on the get of the dam to reproduce in volume?
So you're only asking what influence the sire has? And
We'll
not what the dam
settle for
has?
that. Yeah.
Okay, well, personally, I don't think the sire has any influence on the ability of a dam or a daughter to reproduce. But if you flip that question, I do think if you have dams that have certain issues with breeding, their daughters oftentimes will have the same issues. Okay?
I tend to agree, in the females especially. You know, if you have a female, you have trouble getting pregnant, and you do get her pregnant, chances are you may have trouble with her daughters also. I personally have never thought about it too much from the sire side. I've never thought about a sire having an influence over a female offspring ability to produce.
Okay. Marg?
Well, in cattle, the sire could certainly influence the daughter's ability to milk, and so probably there is some influence there. If the sire's mom was a very fertile, easy conceiving, easy whelping, good milking female, he very well may pass that on to his daughters as well.
Betty?
Well, like the others, we had a hard time understanding the question, and never have thought about it. I think certainly the influence of a female who's an easy whelper, who has nice litters, no problems, that is something that's carried on. I've noticed that, but I don't believe there's any influence of the male. That's, we've really never thought about it, so.
Okay. Well, you're getting chances to think about things tonight. All right. Suzanne, do you think that there's a single most important reason that some bitches don't take, assuming that they're bred at the correct time? Why do we have infertility?
We've always had bitches that we've had trouble getting pregnant. There are a lot of times where theories, a lot of times you're what we call dog-ear bitches. It's harder to get puppies out of, and maybe they're just a little too doggy and not quite feminine enough. We've also seen problems in more recent years with more technology with cystic ovaries. And sometimes treating that actually helps to get puppies from some of these girls. But it's been a frustration all along, I think. I have one that's actually 5 years old. She's had one puppy. And I think part of that question is, when do you give up? Wasn't there a thing on that, when do you quit?
Not on this one, but it may come up.
Oh, okay. Because I thought there was a similar question that was thrown out, that somebody had turned in the same kind of thing, and when do you quit trying? And I think that's an individual thing, you know. Some of us are probably dumb enough to beat our heads against the wall with one dog for a long time, and others say, get over it and move on.
Yeah. Marg?
Well, there are two things that can cause infertility. One is hypothyroidism, and you need to check that one out. And the other one is mycoplasma, which causes a lot of infertility and havoc, and you do need to culture. And if you come up with a positive and it's very difficult to culture, so you have to have the proper culture tube to do it with, and then you must treat for, well, if you do your culture as soon as your bitch comes in season or just before, you probably could get her treated, usually with ciprofloxacin, but for at least 2 weeks or more. And if you're having a severe fertility problem, maybe a month to get her cleared up. And then if she still doesn't take, I don't know.
Okay. Betty?
But those are two things.
Well, I seem to be the most unlucky, but it's very typical. I'm the champion of bitches that don't have puppies. And interestingly, I'm now in another breed, and I hear people say, you know, if they don't, get rid of them. But, you know, I keep my dogs. They're my pets, and it's a problem. You know, I'm not going to be breeding them until they're almost 2 or about 2, and I'm pretty attached to them then. And you just can't keep dogs. But I've bred some up to 6 times, and because now maybe timing wasn't as good back then. I've had some that have had cystic ovaries. I've had some that just never had puppies. I don't know when. I don't give up soon enough. I should. But I don't do testing the first time I breed. I don't look for mycoplasma. I don't look for problems on the first time. Then if I have a problem, then we start working on it. But it's always good luck.
Okay. Peggy?
I think that microplasms and low thyroid can be a reason for not conceiving in a newfie bitch, but sometimes there's just nothing you can do. If you check the thyroid and it's a little low, and you put them on a low dose of thyroid and you treat them for microplasms with doxycycline or Cipro, and then breed them with good progesterone tests, make sure you check the dog's sperm, because we all assume it's always the bitch. It's not always the bitch. Stud dog sperm can fluctuate up and down within a week's time. So microscopes in hand, We do breedings that way. Once I get, after many years of being beat up, breeding bitches, opening them up, implanting them, popping cysts, if I test all them out and I treat for microplasms, treat for a low thyroid, and breed them, and they still don't have puppies, I've learned to give up. It wasn't easy because we spent a lot of time and a lot of money on bitches that never had a puppy, or if they had a puppy, they had one and it had a bad heart or something else. You know, there was just a reason why they shouldn't have puppies. So we've learned to give up a little bit earlier than we did in the past. But those two things to me are the prime things that if you're going to ever get puppies and that's the reason for it, it's a fix. You know, and of course our reproductive specialists are now available to us that can do implants, transcervicals. That increases your chance of getting numbers. I don't think it increases your chance of just getting a good old pregnancy done. I think if there's something wrong, there's something wrong.
Thank you. Kathy?
Well, I'm going to quote something my husband came away from a veterinary reproductive seminar that he attended, and the speaker said that the top 3 reasons for infertility are brucellosis, brucellosis, brucellosis. I think nowadays we tend to not test for brucellosis on a regular basis like we should, and that can often be a culprit. I also think that perhaps with the progesterone testing that we do, we get so wrapped up in tracking the bitch's cycle that once the rise starts, it's like, oh, she rose, we're going to breed her. A lot of times you need to continue to check the progesterone levels to make sure they're continuing to go up as fast and as high as you would expect them to be. And I also think perhaps sometimes these bitches that are supposedly not getting pregnant might be pregnant for a very short period of time because the progesterone level is not high enough and maintaining the level that you need to maintain a pregnancy. And so you may have litters that are disappearing within a few days of being conceived and you don't even know it. I think I agree with the other ladies that treating for mycoplasma, if I have a bitch that's difficult to get pregnant and we've missed maybe once or twice, but the numbers have been right and the sperm's been good, we will go ahead and treat them with doxycycline or Cipro. We do always do the progesterone testing above and beyond the rise. Like the day that we breed them, we take a progesterone to see where the numbers are at, and we expect it to be, 14, 15, 18, and usually you get puppies. So.
Thank you. Anybody want to add anything more on that question? Betty?
I just want to address the brucellosis. I guess I've heard the same thing, but I don't know any Newfoundlands that have had it, and we still miss.
Yeah.
Do you know any Newfoundlands that have had brucellosis?
Yeah.
You've had it?
Yeah.
Then your whole kennel, you've had the males
Well, they can be
problem too.
exposed to brucellosis, and you can have some positive brucellosis.
No, I just don't know any Newfoundlands that have had it, and yet I still have infertility.
Yeah.
Okay. Changing a little bit here. And Marg, I think this is your turn. How do you decide when a bitch is in distress during whelping, and how do you decide that she needs a C-section?
Well, if she hasn't gone into labor, good labor within 30 hours of her temperature drop, that's for sure a sign to get to your vet and get your C-section. If she's pushing hard and nothing is, has pushed hard for a while and not too long either, a short time and hasn't produced anything, I think you'd go to. If there's plaque discharge, for sure you're going to go whether she's in labor or not. And if she doesn't do anything, if she doesn't nest, she doesn't go into any kind of labor, and her due day has passed, I'd get into and get those puppies out of there. It's off from the time they start nesting and fussing around. Sometimes it goes on for hours, and you think, oh, she's never going to get into labor. But sooner or later, they usually do. But if you have any of those things, especially the black discharge, or blood, of course, you want to get in and get something done quickly and save those pups.
Okay, thanks, Marg. Betty?
Well, if, as Marg said, they're pushing and nothing, or if they've gone maybe 4 hours after the water's broken, I certainly go in, if there's nothing. And if you get this green or black discharge, you probably have a problem, maybe a dead puppy that's holding up the works. And certainly, the sooner the better. If you're going to go and pay to have it done, you might as well go and save all of them rather than having them back up and die just as they're getting ready to be born. So there are people that schedule C-sections, and maybe if you've had this problem with the bitch before, I would schedule one right from the beginning and know exactly, you know, when they start to go in labor, I would go to the vet. Certainly, I'd rather have a natural.
Peggy?
I agree with what Marg and Betty have said. Anytime you get any discharge that's not clear white or even clear or egg whitey discharge, you've got trouble. It's fetal fluid coming out and something's going on. Most times something is dying inside. And if you're going to do a C-section, as Betty said, you want to go in and get live puppies, not dead ones. And so you would move along pretty closely. As far as the temperature, if you're going to take a bitch's temperature, make sure you take it 3 times a day and at the same time each day. I haven't had a whole lot of luck with temperatures, but maybe I'm not as good at taking them on time. But I really believe watching the bitch and watching her, for any change in her behavior that doesn't seem natural to you, and any discharge would be my warning signs for going in and getting a section.
Kathy?
Well, I agree with the panel thus far that really the vaginal discharge that you're seeing is a good indication of what's going on. Black, dark green, bloody discharge, you've got something going on that's probably not good. If you've got a whelping going on and you're trying to decide if the bitch is in distress and needs a C-section, I think we've all seen girls that have 8, 9 puppies and they'll have 3 or 4 and things are rolling along and then boom, you're not getting anywhere. If you've gone, you know, if you've given oxytocin and you've gone 4 or 5 hours without any kind of productive contractions and no puppy, you need to call your vet and get in and get a C-section lined up.
Okay. Suzanne?
I think they've pretty much covered it. I was going to make the comment about, you know, if you go more than 3 or 4 hours and you know you've got more puppies in there and they're doing absolutely nothing. That's the biggest frustration, I think, is to get half a litter out and then end up having to go to the vet or find a vet and run around and get the rest of those puppies out and have them still alive. I've scheduled C-sections in the past, but only on a bitch that's had a previous history of a lot of stillborn puppies or, you know, just having a lot of whelping history. I've also scheduled a C-section on a frozen implant. For some reason, I think we had so much trouble putting them in, I want to be sure they all come out alive. So I want to be on the safe side there. But I do think they should whelp naturally if they're able to. I don't think it should just be routinely, they should be routinely sectioned.
Okay. Any other comments? All right. Here's the next one. I'm going to rephrase this question just a little bit. And the question, and Betty, it's your turn. Pay attention. Okay. Do you think that the dogs and the bitches are less fertile today than they were, say, 20 years ago? Do you think that our breeding practices have any influence on that, positive or negatively?
No, I had misses long ago, but now at least we have more scientific help, and we have progesterone testing. I can remember many, many times they used to say that you breed them on the 12th and the 14th day. Well, it's not so. And it's not so if they do one time, the next time that it's going to be the same time. And so we have the progesterone testing now, so why not take advantage of it? I'm not saying my production has gone up, but at least we have some really good help and some good answers. There's some other things I can mention, but we'll get into them with some of the other questions. Thank you.
Peggy?
I think the technology available to us today has enhanced our ability to produce more litters and more numbers in the litters. As far as bitches that just will not conceive, that hasn't changed. You know, there's nothing, and there's no technology out there for them. It's just going to happen. But our technology gives us the ability to really increase numbers and get bitches pregnant. And sometimes you'll track a bitch and she's going up beautifully, and you keep tracking her, don't stop, and find out that she never really gets further than where she should to hold a pregnancy. And here you've done the breeding based on the numbers, but her progesterone doesn't go up high enough to hold it. At least you know that now. You know, we didn't have those tests available to us years ago, so we just kind of said, well, I wonder what happened this time. Now we know, and we can probably correct it in the next season that she has.
I agree that the technology nowadays has helped us immensely with having successful breedings. And I would have to say that I don't think that the dogs are any more or less fertile now than they were. I think it's more technology is giving us answers to why we haven't had pregnancies when we've expected it.
Suzanne?
I have to agree. I don't see any increase or decrease per se in fertility. I think we're better able to cover dogs when we breed them. I think we're better now. I can remember killing ourselves trying to get breedings years ago, and now we routinely do more AIs, and you're able to cover even with a combination. You could start a bitch a little early when she really isn't receptive, then do some naturals, then cover her on the end. And again, once again, the progesterone, we keep harping about that, but that's been a huge help, I think, in getting successful breedings.
Okay. Marg?
Well, one thing that still applies, I guess always has, these people that never go anywhere and have their dogs out in the backyard and don't even plan a breeding seem to get litters. But I think we pick up things on the show circuit. Mycoplasma I still think is a big problem, and you can pick that up on the show circuit. They're stressed and it's hot, and the judge is going down the road with his fingers in everybody's mouth, passing things along the line. And those things can hurt, and I think that's one reason why these people that just don't go anywhere seem to always have a litter, whether some of us have problems.
All right. So, Peggy, we're back to you. And this question makes a good follow-up on what we were just talking about. Do you use primarily AIs or natural breedings? Do you think there's a problem in maintaining an aggressive stud dog by using AIs and not letting them breed naturally?
Well, I prefer to do an AI for many reasons, and one of them is it's a cleaner way of breeding. You cut down on infections transmitted between the dog and the bitch. I do think that if someone requests doing a natural breeding, that's not a problem either, and I'm certain that the dogs will accommodate. There's no question. But it's nice to be able to bounce back between the two, because there are times when getting a natural breeding is impossible due to some reason with the bitch. They can be receptive and still be mean as hornets about having a male mount them. They're a little dominant or something, and then you can't get the breeding done. And the AIs gives you also the ability to check the semen on the dog. And as much as we all blame our girls for the problems, you have no idea how many times our males are just as much a culprit. And you need to know that information so you can treat the male for whatever's going on and correct that problem and bring him back to a higher sperm count. Things fluctuate within the dog just as they do within the bitch. And a lot of times you'll miss on a bitch, and it's always, what we can do to get the bitch pregnant. Check the dog. Anybody that's using any kind of active stud dogs on a regular basis should get a microscope. And you don't have to be an expert and know everything that's abnormal about the sperm, but you do need to know that it's moving, and it's moving well, and it's lasting long on the slide.
Kathy?
I think Peggy covered it very well. I agree with what she said.
Next.
I'll have to agree with that too. My favorite present I've received in many, many years was my microscope. I never do a breeding. Every time, even through a course of breeding one bitch, every time I collect the dog, I check the sperm. For me, I would prefer AIs just because I usually am doing breedings by myself and trying to get a tie. by myself can often be a problem, and it's very frustrating for the dog and the bitch sometimes. I do think it's cleaner as far as infection. In touching on all the mycoplasma and everything, I routinely put my bitches on antibiotics before they're bred. That's just part of my breeding program. But I like being able to look at that sperm and know exactly what's going into the bitch each time. Another thing, Dr. Truesdale, who's a reproductive vet that I've used, recommends adding the extender every time, even though we're doing a dog-to-dog breeding and not shipping anyway, that the extender just enhances the sperm and gives it better quality. And so I've done that also.
Mark?
Well, I do quite a few natural breedings. We do AIs. If we have a bitch come in and she hasn't been cultured and treated, if she needed to be treated, because we just don't know where we're at with that. But with my own bitches at home, I usually do naturals. I do culture as soon as they come into season, and we stick them on ciprofloxacin if there's been any problems at all with mycoplasma. If I've ever got a positive, say in the last test I did on the last bitch, we'll put them on the ciprofloxacin for 10 to 14 days. And when the culture comes back, if they have grown something else that's not appropriate for, we can adjust. But unless the dog is too small and the bitch is tall, I find a tall dog can breed a smaller bitch much easier than the vice versa, because they get the right angle properly. But if you get a dog and a bitch that don't match in size, then yeah, we do AIs. Or if I don't always do the progesterones either. But if I think it's time and we're not getting anything, I get that AI done, and then it gives me a couple of days grace to see if she's coming along a little better in a couple of days, and at least we've got the breeding done.
Betty?
Having struggled for many years in the early days with big dogs wrestling with people trying to get breedings, it has been wonderful that we can do AIs. But I think it's also really important, since we are now sending fresh chill semen, which is certainly better for a bitch rather than shipping a bitch someplace, that the dog gets used to being collected and will let you collect him. And I know in the past people say, oh, my dog would never do that. You know, he does it naturally. But you're going to want to be able to ship fresh chill semen these days, I think. And so I vote AI entirely.
Okay. Well, two of you really answered this question, partially, but the answers that you gave me lead me into this question, and I think we'd like to just go through quickly and survey. Do you do a sterile culture mid-season, or do you routinely treat with an antibiotic during the season?
Me?
I think you're Peggy.
Yeah, Kathy.
Okay. Usually on a first breeding, if it's a young bitch, seems to be a healthy bitch, I don't routinely culture. What was the other part of the question?
Well, do you do a sterile culture mid-season, or you just routinely administer an antibiotic?
Okay. Do not typically do a sterile culture unless the bitch is proven to have some problems. Also, tend to stay away from using antibiotics unless you know you've got a problem. Rarely do I give antibiotics to a bitch prior to breeding her just because she's coming into season and I'm going to breed her. If I've had a miss or we've had some signs of an infection problem, then we'll dig in a little deeper and start trying to figure out what's going on and treat it appropriately. Personally, I think antibiotics can be overused.
Suzanne?
We used to do sterile cultures all the time years ago and treat the bitches accordingly. I have in recent years gone to, as I stated previously, pretty much routinely using the antibiotics when the bitch is in season. And not necessarily on a first-time bitch, but a bitch that's been bred before, a bitch that's whelped before, and especially if there's been any question of any problem in trying to get them pregnant. It's become kind kind of more of my
Okay,
breeding plan.
get your mouth closely. The volume's not.
Yeah, it's pretty much
It's
been-
set for my voice, not for yours.
It's pretty much been part of my routine to use antibiotics.
I pretty well routinely take a culture as soon as she comes in season. Mid-season is too late by the time I get my results back to get her treated before the eggs are attached. So I'd like to get that culture done right away. And if we've had any problems whatsoever, or if the last culture I did on another bitch has come back positive for mycoplasma, I'll start right away with the ciprofloxacin too. And we've had very few misses lately, and actually I'll sometimes treat the male too. I'll treat both of them while they're at home. Usually I use my own dogs. So we'll treat both of them if we've
Somebody's leaning against a light switch someplace.
problems at all, and we've been having good success. We rarely have a miss. We usually have some good sized litters.
Okay. Betty?
We used to do sterile cultures. I really don't do them anymore. And certainly, the first time I breed a bitch, I am not anticipating problems, and I will not treat her or do any further tests. But if I start having problems, if she misses, then I start looking, and I will check thyroid, and I'll check for, do cultures. But people from other breeds who have a higher fertility rate rarely do it, and my veterinarian always advises against giving antibiotics unless there's a proven need for them. So I don't do that.
Okay. Peggy?
I think the ladies have covered most everything. I wouldn't use antibiotics on a first-time bitch, but if there was a problem, I would do a culture and then treat appropriately.
Okay. Going on with the question on getting the breedings done. Suzanne, I think it's your turn. Again, I'm going to rephrase this question slightly from how it was given to me. I'd like you all to speak about your success both in terms of conception and size of litter using surgical implants, transcervical AIs, and regular AIs.
Well, I've never done a transcervical AI. So, and I've only done, I think I've only done one implant. I have to stop and think. Yeah. I've had definitely more success in using AIs and progesterone and being able to cover the bitch for I like to try and cover them even longer, a little bit before the progesterone says to and after, as long as I can. The one implant that I did, I got 4 puppies from. I use a tube that's actually a catheter tube in my AI, so I think I usually can get up there pretty well, and I've had a lot of success with it. But I've never done a transcervical. I don't know if any of you ladies have done them or not.
Well, Marg, what's been your experience?
I would use transcervicals if I could, but we don't have a reproductive vet. I've just sent some chilled semen out, and they got 8 puppies with a transcervical, so they were very pleased. I have about equal luck with natural breedings and AIing. I AI myself at home, and again, I have a catheter that I sometimes when I'm sure I'm getting through the cervix and right up in there. So I've had big litters, like 11 or so on with AIs too. I've had no luck whatsoever with frozen semen, absolutely none with surgical implant with frozen. But then I don't have a reproductive vet either. I've had fairly good luck with chilled semen surgical implants.
Betty?
It's not really a matter of luck. I mean, I don't do natural breedings anymore. And I do AIs, and if it's going to work, they work. I don't have a vet that will do a transcervical. If I did, I certainly would. I think that's the best way, rather than an invasive surgery. I have done 1 implant, and I found out when I did it, which was good, that the bitch had ovarian cysts, and so they were able to pop them, and she did get pregnant. So there was a reason why she wasn't pregnant, and there was a good reason to do an implant.
Okay, Peggy?
I think that if a bitch is going to get pregnant on a natural breeding, an AI, transcervical, and implant, it's going to get pregnant. If you're looking to take a good bitch that only gives you 2 or 3 puppies each time and increase the numbers, I think your transcervical and your implant will do that. But I don't think you're just going to miraculously have a litter because you do an implant or a transcervical. I think you've got to solve the problems of the bitch first. But I do feel and have had experience that it does increase the size of the litter to go in and do an implant or a transcervical over just a natural AI. But if a bitch is fertile, 10, 12 puppies in an AI or a natural breeding will result.
Kathy?
We've never done transcervicals. We've done surgical implants, and I think fresh chilled or freshly collected semen on the site and then doing a surgical implant, you will get bigger numbers, without a doubt. That's been our experience. We've done frozen semen breedings. We've had 100% conception on the frozen semen breedings doing a surgical implant, but the numbers are small. We've had, I think the largest litter was 5, and the smallest litter was 1. I think Peggy has a good point that if a bitch is going to get pregnant, she's going to get pregnant no matter what, if it's an AI or a natural or a surgical implant or a transcervical. But I do think your numbers will increase when you intervene a little bit with a transcervical or a surgical implant.
Just want to make one last comment because my only experience with the implant was with frozen. I've never done a surgical implant with fresh.
Well, they recommend that.
Yeah.
All right, Marg? Pretty simple question here. Think you can handle it? At what age do you usually start breeding a bitch, and at what age do you usually start breeding a male? Usually.
Well, if I've got a young fella at home and I have a bitch that is right for him, I'll breed him at 11 months. It's sort of nice to get him started before he gets all girl crazy, and it's almost as natural as eating his dinner or whatever. Also, then if it's a proven older bitch, I can see if he, what kind of a job he's done and if he makes the team or not. So that's sort of fun. And usually they're developing this will be a natural breeding too. I would do when he's a youngster like that, and it sort of gets them on their way, and they turn into pretty good stud dogs. Bitches I usually leave till around 2, unless the male I want to use is an old fella or there's some reason that I need to go earlier with her, so I'll do her preliminaries then sometime after 18 months. If there's something like the male is going to be moving out of the country or something like that. What's the rest of the question? Is that it?
You got it.
Okay.
You did good. All right, Betty?
Regarding bitches, it kind of depends on how their season comes. I breed only when it's going to be convenient and I'm going to be home for them. But I have never bred a bitch earlier than maybe 20 months when they would whelp at 22 months, and only if I've done preliminary health checks, which I always do early. So I know. And the same thing with a young male, I do x-rays, preliminaries at 6 months, and then I know pretty much the way they're going to go, and that they won't stay there if they were not going to make the grade. I don't think there's anything that's too early for a male as long as he's got viable semen, and I know that at least at 10 months they usually do. And if you do it, it's not going to hurt the dog. He's going to have a hell of a good time. So it would hurt a bitch, I think. If you bred a bitch that was a year or 13 months, I wouldn't do that, but I don't think it's going to hurt the dog.
Peggy?
I would say that a year-old dog would be the earliest I would breed him to get a good preliminary view of his health clearances, at least at a year, and a bitch 18 months or older.
Okay, Kathy?
Well, I thought Marg had a good point, and I've done this myself. I have bred a young dog that I'm maybe kind of excited about, talking 10, 11 months old, and as a test breeding, we'll breed a young dog to an older bitch that's produced a couple litters for me, and I've got a good handle on what she can produce and what she's done in the past. And then you use this nice young boy and kind of do a test breeding to see, like Marg said, if he's going to make the team or not. We do prelims on everything at 12 months, and so I wouldn't breed anything unless I've got a prelim done on it. Females, I think the earliest I've ever bred a bitch is 18 months. I think that being pregnant and doing a litter is a pretty big job, and 18-month-old bitch is just coming into being able to handle something like that because they're still growing and still maturing.
Suzanne?
I pretty much agree. I, like Betty, usually prelim all of my dogs around between 6 and 8 months for a first round, mainly because if they're not going to pass, then they're not going to stay. And I think the earliest I've bred a bitch is around 18 to 20 months. And usually that depends on how their seasons are falling. I've not bred a male before a year. I like to have an adult heart check on them. So I like to get that out of the way before I would use any of them for breeding.
All right.
Another comment, I remember reading when I was first starting that you should start your male at a certain age. Well, you don't start them unless there's demand, you know? And it's not like a bitch. I couldn't understand it, and I still don't understand it. I can remember saying you should start your dog at 12 months and then not do it again until 14 months. Well, if no one's asking, you don't do it, you know, so. But as soon as, I would use him as soon as he's capable, and I've had some health checks done.
Any other comments? All right, Betty, I think it's your turn. This is going now. We've got the dogs pregnant, and we have our litter. And son of a gun, we got some 8 to 12 ounce puppies in there. What's been your experience in terms of managing those small puppies? And what specifically do you do to handle it?
Well, I assist. I don't believe in the survival of the fittest, particularly if it's something like an age thing. And if I will try supplementing if the bitch doesn't have milk, or if somebody's getting crowded out, I might put that small puppy on the bitch by themselves, or I might let it eat and then supplement it. I have done bottle feeding, I have done tube feeding. As long as it's not an orphan puppy, I think tube feeding is fine. If you know how to do it, certainly it's kind of tricky. But if it didn't have a mother to nurse on, then I would do bottles, because I think they do need to nurse, or suck on something, I should say that. But I make up a formula, and we'll supplement. I want to get them over 2 pounds before I feel comfortable with a puppy.
Peggy?
I agree with that 2 pound. That's when you breathe easy. But one thing about a 8 to 10 ounce, 12 ounce puppy is it's usually a little bit frail and thin and unthrifty looking. Be sure to hydrate it, and if you can't do that by tube feeding, you can also administer sub-Q fluids. I wouldn't think of having a litter of puppies without some of those on hand. Also be sure that the puppy doesn't get chilled, because that will surely be the demise of that puppy. And certainly intervene and try to save every puppy we have, unless it's not thrifty enough to make it.
Kathy?
When we've had little 8, 10, 12 ounce puppies, pretty much what the ladies have said, we do intervene. I oftentimes will keep the little ones in a box with a heating pad by themselves and make sure they have individual time on the mother without having to fight with the bigger puppies. I don't like to tube feed puppies because it bugs me. So I will take the time to bottle feed them. I think it's good for them, and nursing is good for them. Little guys like that, you maybe only have to feed them tiny amounts, but often, every hour and a half. And the 2-pound mark seems to be a real sigh of relief when they plump up and start to look like they're going to be strong and forward hoe.
Suzanne? Grab that mic.
I have to say, I pretty much agree with Kathy here in that tube feeding and I are not friends. I do it when I absolutely have to. I do it with mortal fear. And I usually use that for a puppy that's fading. And I have seen fading puppies turn around dramatically with 1 or 2 tube feedings. I've supplemented with a bottle. I don't routinely supplement. I only do it when I feel they need it. The little puppies we try and put on, keep on the mother more than the others, keep them separate, be sure and monitor them very closely as to what we feel they're getting. And tube feeding is always the last resort for me personally.
Okay. Marg?
I've only had little puppies like that once, but it's very, very important they be kept warm and much warmer than the others. Like other little older puppies, I think 95 degrees, I had to keep this guy, this little fellow warm. And I do, if they can't suck, then you've got to tube feed till they're strong enough to suck. Because if they can't suck, then what are you going to do? And again, put them on the mama separately so they don't get pushed off by the others.
Okay. I can't believe how quiet and attentive you all have been. I think you deserve a chance to do a little talking yourself. So I'm going to open it up to the floor. Remember, my guidelines are try to limit your question to 60 seconds so we're not getting a speech. We'll be starting with Peggy on the first question because we just finished with Betty. Ron, is there anybody in this area that wants to ask a question? Raise your hand. Okay, go ahead. And when you introduce yourself in terms of your name and where you're from.
I'm so shy. I'm asking this question.
Talk into the mic.
Whoops. Okay. I'm asking this question for somebody else. Okay. My name is Anna Hubbard. I'm a Rosa, Newfoundland. Peggy, you mentioned cysts, treating cysts.
Yes.
Okay. I've had a bitch who, when she was implanted, they did find cysts and they did treat it by popping it. Is this the way we normally treat them, or is there a way to find it before and treat them then before?
I really don't know, maybe an ultrasound, but I know that most times you're going in to do an implant because you've had some problems with the heat cycles, with conception on the bitch. So they go in to do the implant with the live sperm, and they find the cysts. They can pop them right there. They do say they will come back, but for that particular conception rate, it should be fine.
Okay. Kathy, have you had any experience? Cysts?
I didn't know, I thought Anna directed the question.
Well, I know, but everybody gets a chance to answer regardless.
Okay,
Yeah.
yeah. I don't think I've ever done an abdominal ultrasound on a bitch and had cysts show up. I don't think they show up. I don't think you realize you have cysts until you've actually gone in and done an implant. It's like, oh, look at all these cysts, you know. So really, popping them at the time is about the only thing you can do, as far as to my knowledge. And yes, they do tend to come back. So if you have a bitch with cyst problems, you're going to have problems throughout your entire time trying to breed her.
Suzanne?
I've never had the experience of going in to do a section or something and finding the cysts and popping them. The one dog I was talking about that I have now that's 5 years old and has had one puppy has been seen by a reproductive vet, and he is operating from her history under the assumption that she is probably cystic, and he has put her on check drops because he feels that they have a history of dissolving cysts. So I'll let you know if we get puppies from her.
Yeah.
This is just great. Go ahead, Mark.
Are you going to publish it in New Tide?
Yeah.
That would be good. We've found cysts on occasion when we've done a surgical implant. That's one good thing about a surgical implant, because you do find out the condition of that uterus and what's going on in there. And I have done a surgical implant just for that reason, with fresh semen. Well, actually, we were breeding two bitches at the same time with fresh semen, which we split from the two bitches. But both of them I'd had problems with, and we did get 5 puppies in each bitch. And we did find out the condition of the uteruses when we went in there.
Okay. Betty?
I did 1 surgical implant. The bitch had been missing. She had cysts. We popped them, but perhaps since we're hearing they're going to come back, it's time to remove her from your breeding program. And I did.
All right. Thank you. Anybody in the center section want to ask a question? Down here in front, Ron. Sure. She got her hand up fast. She got very quick, people.
What is the oldest age that you feel comfortable breeding a bitch? Not you personally, but the bitch.
The question is, what is the old?
We took that away as a possibility.
The Kathy gets this one first.
Oh, good.
The question is, what is the oldest age at which you feel comfortable breeding your bitch?
We're all youngsters.
I think the Newfies are unique in that they have a very small window of reproductive ability, the bitches especially. I have only bred a bitch once that was 6 years old. Most of them are retired and out of the breeding program between the ages of 4 and 5. So.
Okay. Suzanne?
I'm not breeding as often as I used to, and I'm trying to retire from it, so I don't breed my bitches as often as I used to, but I had 2 bitches that actually produced puppies when they were 7. They were bitches that had been reproductively healthy, had produced good litters and good quality litters for me, and never had a C-section, either one of them. So I continued to breed them, and they continued to conceive.
Marg?
7 is the oldest I would breed a bitch, and I've had some good, healthy, strong litters from 7-year-olds, but once I bred one at 9, and that was a disaster. She looked like a 2-year-old, and she was so pretty, and I thought, oh, well, let's see, but we had, almost every puppy had something wrong with it, and I'll never ever do that again. Mind you, it gave her a boost with all those hormones, and it just made her look even younger. But no, it wasn't a good idea at all.
Okay. I want to make sure that I heard you. Did you say 10 years old?
9.
Oh, 9. No, the oldest that you had. What was the age you said at the beginning?
I bred her at 9.
Okay.
But it was a disaster. Like I had.
Okay. What was the other age that you said?
7 is what.
Oh, 7. All right. I couldn't tell whether you said 7 or 10. I thought, my God.
Not 10. 9 is not a good. When a friend of mine had an accident at 9, and with her bitch at 9.
Okay.
Both girls' name were Sarah too. And
Betty?
those puppies, that was not a good breeding either.
I would say a good age to stop is 6. I think you're going to get smaller litters as they get older. And somehow I tend to think a bitch's first litter is maybe her best, but 6 is a good time, I think, just to stop. On the other hand, starting whenever I may start at 2, I think it's best for them if you keep it rolling and do it every other season. Don't have a litter for the best of the bitch, to keep it on a cycle, maybe skipping every other one, so having a litter a year, or a litter every 20 months or something, whatever her cycle would be, is the best way to keep her uterus healthy.
Okay. Peggy?
We generally, from past experience, do not breed bitches after 6 years of age. I attended a seminar many years ago at the University of Pennsylvania School of Veterinary Medicine, and they had done some studies, and the doctor that was giving the seminar said that they had somewhat narrowed it down to the first 6 heat cycles of a bitch will produce the healthiest offspring. I've seen it happen. I've also had bitches that are 5 and 6 that produce healthy puppies too, but generally after 6, things start to go downhill. And when you consider a bitch is born with all the eggs she's ever going to have, when they get to be 6, they're pretty old.
Yeah.
Have you had success getting a bitch to conceive that short cycles? Meaning, or erratic cycles, short, not quite as short, almost normal, and then short?
I've had mostly not success, but I did have a bitch that cycled every 4 months. And she always conceived every time we bred her. In fact, she's one of the ones that had a litter at 7.
My foundation bitch was a 4-month cycler, and she passed that on to her daughters and her granddaughters and her great-granddaughters, and it just gave me more options, and we had no problems at all. So,
About less than 4.
Sometimes they're brought in by somebody else, but that's, I mean, you wouldn't. I never had any problems with the short cycles. We just bred them I made sure they had a year's rest, and we just went ahead, and I didn't have any trouble at all. Now I've got some that don't cycle any oftener than 7 months. So that gal is long gone out of their system. This was Piper's mom that used to cycle every 4 months, and for a long time we had many that did that.
Betty?
I certainly would prefer a bitch that comes in every 6 months, but, I think if they get cycling less than every 4 months, you're not going to get puppies, my experience is that you haven't. On the other hand, those that come in a little more, you have more flexibility, as Marg said, you're going to go away and you can't have a litter, you know they're going to be back in again. I kind of envy the horse people that have a chance every month, but we don't have that.
Yeah. Peggy?
Exactly. I think that I would consider short cycling every 3 months. Anything 4 months or above, I've never had difficulty getting puppies, but anything 2.5, 3 months, I don't think the uterus has enough of a lining left to conceive a pregnancy if it's 2.5 months from its last heat cycle. There's certain things that go on inside the bitch that make that uterus wall able to conceive a nice healthy bunch of puppies, where if they're ovulating and you breed them, even if they're ovulating and you breed them on a 3-month cycle, I've never had a litter from that type of timing.
If I understand the question, you've got a bitch that's really erratic. 3 months and then 5 months and...
3 months, almost 4, 5, 3, almost 4. She had six cycles when she was 2.5 years old.
Yeah. Let's just say she's really suspect as a future brood bitch for you. However, if you're looking for something to try, I think putting her on check drops, and I don't know if you've tried that, but sometimes you can put them on check drops for 8, 10, 12 months and then take them off, and sometimes you can break that erratic cycle. And usually the first heat after a check is 4 months, 5 months, and you might get by with it, but she doesn't seem like she's going to be a real good candidate for you as a brood bitch. But if you're...
The reproductive specialist recommended trying her once before doing the check.
Yeah, I agree with Peggy. My experience has been with anything less than 4 months, and you don't have enough of a lining in the uterus to hold a pregnancy.
All right, do we have a question from the center section?
May I say
Ron?
something more?
Whoops,
May I say
sure, I'm
something
sorry.
more?
Ron,
How
over
old
here.
is she? How old is this bitch?
She is now 2, she's past 2 right now.
And have you tried breeding her at all?
Not yet.
We had one that was cycling quite often, 2 months. But she took on her first breeding, and after that she settled into a 6-month cycle. But she was being brought in by other bitches in season 2. But she was bred, I think, around 2, and after that she was okay.
Okay, Ron, gentleman right in front of you there.
Yes, my name is John Gerber. I recently attended a breeder symposium, AKC breeder symposium at Ohio State, and I was informed that breeders have the potential to breed out 95% of all diseases in dogs. Of course, I would be curious to know your own outlook on this in terms of your successes or failures, of how you've contributed to that premise.
I'm going to ask for just a slight clarification there. What he said was that at Ohio State University at a breeders' symposium conducted by the AKC, that one of the speakers said that breeders have the potential of breeding out 95% of the genetic diseases? Okay. I think, who gets to try that one first? How do you feel about that? Betty, go ahead.
Well, golly, we sure need some help with that one. I mean, we've done okay on our hips, and we're doing quite well with that one, and those ones we can x-ray, or in cystinuria, that's a cinch because it's simple recessive and we have a DNA marker. But we can try and try and try, but some of these things, they crop up, and you don't know where they've come from even, unless we have some help from the veterinary association. I can't see how we can do it ourselves if we don't even know how to identify in our breeding stock, and then it comes up. But we sure try.
Maybe they're talking about the future when we have DNA on all of these diseases, and that would be wonderful. But just looking at the time I've been in it, and Peggy, between us with hearts, we don't ever breed anything that has a bad heart. And we've been going to cardiologists for 30 years or more, 35 years, and we still have puppies that have heart defects. Say the time will come, maybe. The AKC knows more than we do, or we have to sink some money into these studies and get some DNA markers.
I'll just say
Peggy?
one thing. I think the potential is there.
Yeah.
But we need the veterinary profession, and we need the Newfoundland Club of America and a lot of other clubs. The AKC's funding a lot of things through the AKC Canine Health Foundation. But we need some markers. We need some aggressive programs on health. And then I think the future is great, but 95% is a very ambitious figure, in my opinion, right now, as the science is for the Newfoundland dog. We have one marker for all the problems that we have in the breed. And until that starts increasing, I'm not sure how we would solve 95% of the problems. Certainly no one, I'm sure, at this table or in this room would want to breed unhealthy puppies. But we need the help from the pros, which are the veterinarians and the researchers.
Okay, Kathy?
I agree that potentially we should be able to breed 95% of the health issues out, but we really need the science behind it to do that. Just from experience and how, this panel is breeders, longtime breeders that are doing their health clearances, breeding clear dogs to clear dogs. And I can give you two different examples of how you feel like sometimes you're banging your head against the wall. I can have a pedigree that has 5 generations of OFA excellent hips on both sides, and you still have a litter that has puppies with hip dysplasia. And what more can we do? We've got 5 generations of OFA excellent hips. Conversely, with the heart issue that we all fight against, you do a breeding. I've done a breeding, had 10 puppies, all the hearts cleared, perfect. And I'm thinking, oh, I'm onto something. I'm going to do that again because that was so good. And repeat the exact same breeding, and half the puppies had SAS. So, we're doing the best we can, but eliminating 95% of the health issues at this point, no, we need some science behind it. Yeah.
Suzanne?
I have to agree. I think maybe this person that was speaking at the symposium said that, we're now getting into a scientific area where we're going to have this help in the future. But right now, cystinuria is the only thing that we can guarantee that we will not produce. And once again, I had exactly the same experience with a repeat of a litter of puppies, where the first litter was entirely clear on their hearts, and the repeat breeding had multiple hearts in it. I've also, a simple thing as far as health goes, but a frustrating thing for us as breeders, are bites. And I went through a siege of bites back in the 80s of malocclusions where the mouths didn't shut. And I know exactly the last litter I had with bites like that was in 1982. And I sold a bitch to Italy, and she was bred over there, and I went over in 1996 to look at the litter, and half of them had mouths that didn't shut. And I thought I'd long since seen the last of one of those bites. So things are still lurking, and they pop up. And we need a lot more science to help us to get rid of the big health issues. The bites are minor, but the big health issues we really need to work on, and we need help.
I'm Anna Lorenz from Wisconsin, and I'm curious about what experience all of you have had with dual sire litters, and if you have full confidence in the AKC's current abilities to determine paternity with DNA.
Where are we?
Your turn.
My turn?
Yep. Marg did the last one.
I only did one, and I found it fascinating figuring out the sire. I had guessed it, but it came out. It was wonderful, but I understand that if the two sires that you use are closely related, it is more difficult, and maybe you have to let the AKC make it. But I had full confidence reading mine, and it was fun to look at the charts and figure it out.
Peggy?
I find the multiple sire concept really interesting. It is a little frustrating, the timing to get the paperwork done and in and back for your puppy people and tell them who the father is. But I think that it gives you benefits if you have an old dog and the semen isn't as great as you might like it to be, but you want to do the breeding, and then you can take a young son and do both of them. You've covered it. Our reproductive ages for our bitches are so short, the window's short, that you want to cram everything you can in. I think the AKC, and Fred, you might know this, the percentage of accuracy is like 99.6 on the parentage, so it's pretty safe to say that.
As somebody said, if you have two sires that have that same mitral background,
Yeah.
then it makes it more difficult in being absolutely sure.
Right.
If you've got two, if one's an outcross and one's an inbreeding, then it's a lot easier to see the difference in the DNA specifics.
But it's pretty exciting to guess who the daddy is, but it's frustrating at the same time.
We've done some multiple sire litters. It is very frustrating with the AKC getting the paperwork done because their DNA department is very slow. So you've got puppy people with their puppies and they want to know who the father is, and sometimes the DNA tests don't shed enough cells and you have to retest, so things are backed up another 6 or 8 weeks. The multiple sire litters that we've done, I had one litter that had 2 sires, and the other 2 litters that I've done, there was only 1 sire in each litter. So I felt like I wasted a lot of time and money trying to find out who the daddy was. But it is a fascinating concept, and when you do the breeding, you're excited because you're going to be able to try 2 different combinations at the same time. And so the concept is pretty cool, but the paperwork is very frustrating.
It's very expensive.
Yes, it's very expensive.
Suzanne?
I think the concept is great. I personally have not done one, so, but I think the idea is great, and I like the idea of 2 daddies.
Marg?
I haven't done one, and I'm not sure if CKC allows us to do them, but I haven't checked. Peggy, did you guess right on your puppies? Did they come back the way you said?
The one litter, yes.
And yours?
Yes, yes. One dog didn't have much semen.
So they're all on daddy? Oh.
Okay.
If you have a 6-year-old bitch that gets pile, do you treat her or spay her?
There would be no question that she would be spayed. The treatment for PIO with the prostaglandin is a pretty rough treatment, if any of you have been through it. And a 6-year-old is finished, and you want to get that uterus out of there for her own well-being and long life.
Okay, Kathy?
I agree that a bitch at that age, to put them through the treatment for a PIO and the risk that goes with that treatment, for what? She's 6 years old, spay her, keep your dog alive.
Suzanne?
I think I would almost always opt to spay the bitch and not treat her unless she was young and I didn't have anything out of her. then I might try to save the uterus by treating it to see if I could get something from her. But if I have any offspring of hers, there's no question I would spay her.
Marg?
At 6 years old, she'd need to be spayed for that. But if she was, you know, a young bitch, maybe I might try treating her.
I treated one bitch with prostaglandin, and I will never do it again. I know I've heard Dr. Hutchinson say it's fine and so on, but if you watch your bitch and have to live with it, it is really horrible. And I never got puppies yet anyway. So no matter what age, I would spay them.
Okay, thanks. Right here, Ron.
Hi, it's Sue Auger from Denali Farm, Newfoundlands, and I think we all have our methods of dealing with bitches in between the puppies during the whelping. And I was just really curious what you all did, besides oxytocin perhaps, to speed up the whole process of the whelping from the first puppy to the last puppy.
Oh, okay. The question is, at what point you use oxytocin, and what's your protocol using it once the bitch goes in labor? That's not your question? Oh, besides oxytocin. Okay.
Oh, it's this big thing
Is
besides
that-
oxytocin.
that-
Okay,
got
so
that then?
you're whelping and you've got a couple puppies out and you want to keep things moving?
A bitch full of puppies, and she's had her first puppy. Now you have the whole process. Is there anything special that you found that you can do to speed the process up? In between puppies.
Right, okay. Well, you have to kind of have the mindset that it's going to take a while. Especially if you've got 8 or 9 or 10 puppies, it's not uncommon for at least an hour to an hour and a half between puppies. So you've got to get the mindset that you're going to be in your whelping room for a good 12, 13, 14 hours. But to keep things rolling, I think sometimes the bitches get dehydrated. So I will encourage them to drink by putting salt on their tongue to make them thirsty. I do think that they get low in sugar, and a really good thing for that is I keep Caro syrup in my whelping room in a syringe, and I will give them 5 or 10 cc's of Caro syrup every couple hours just to kind of perk them up a little bit. Oxytocin, I think you have to be careful starting that too soon because it hardens the uterus, and eventually you don't get nice pushing contractions, you get short binding contractions, and the puppies go nowhere.
Suzanne?
My vet, I don't like to use oxytocin early on if I can avoid it. We use Calphasan. We've used that. Ice cream. Taking them out and running them around the yard. Sometimes even just letting them out. It's amazing getting them up and out of the box, and they go out and all of a sudden, boom, they have a puppy when they've been doing absolutely nothing. Just a little change of scenery sometimes also. But we usually, as far as the oxytocin, I always use the Calphasan prior to. I really hate having to use oxytocin sooner than halfway through the litter.
Okay. Marg?
I always feel with oxytocin, you're damned if you do and damned if you don't. And you don't want to use very much. Half cc sub-Q is plenty, and you don't want to use it any sooner than you have to. But if you've got 3 puppies and there's lots more and nothing's happened for 3 hours, well, then it will. But I let my girls go outside, and we have a nursery and then a nursery yard, and they like to go out there and dig around and walk around, and they'll often have their puppies outside, and then I rush out and get them and bring them back in again. And they sure breathe quickly, and they're dropped in the snow. But they whelp so much better if I let them go out there and pace back and forth, and then they'll have their puppies. And so they do that, and most of them are born outside. Then I run and get them, bring them back in quick.
I would use calcium and oxytocin. I do use, but I use it later. If I don't like them to go more than 2 hours between puppies, and then I do go outside, and most of the time it's at night, so you go out with a flashlight and a towel, right? Or you go to the vet in the car, and they have it because they're in the car, so take them for a ride.
Okay, Peggy?
I think the gals have covered it. Keep them well hydrated. We use honey, Karo syrup to give them a little energy. We do use calcium. My vet feels it doesn't cause contractions like oxytocin, but it strengthens the contractions that the bitch has, so they push a little bit harder. And once they start that, I'll take them out for a walk, but never without a flashlight and a towel, because in the middle of a snowstorm, whoop, here comes the pup.
John Wilmont from Canada, and my wife's sitting up there. The question I have for the whole panel is about cruciate ligaments. And I'm wondering if I could hear a comment from all of them about there seems to be a much more prevalence of it now. I remember years ago, I hardly ever heard of it. And now our vets are telling us cats are even getting it, little dogs, big dogs, the whole bit. And I don't have any answers, and maybe the panel has some insight into the problem that seems to be, at least in a lot of areas, quite prevalent. And
That's a great question, because I think one of the things that I've heard myself, John, as I go around the country talking to people, is how we go through cycles of problems in breeds. And it seems right now that we've gone into cruciate things. Whose turn is it? Suzanne's? What's your reaction to, do you think there is a cruciate problem, and do you have any idea what's causing it?
Most definitely. And I'm talking on my own little soapbox right here. I don't know what these ladies think.
That's what we want you to do.
I've been watching in my own breeding program for years, dogs that I sell that seem to tear their cruciates. Probably 95% of them are male dogs that were neutered young. And I think we've seen an increase in the cruciate problem with the advent of the early neutering that's come along through rescue and everything else. When I had my first dogs, the first 10, 15 years I was breeding, nobody ever neutered their males, and I never had calls that this was happening. I get more calls now, and as I say, it's almost always a neutered male, and I recently saw some statistical information on that's a definite, that's where they're seeing most of it. Cutting those hormones off early, I think the dog develops totally differently. And I'm now encouraging my pet owners not to neuter their males. I'll knock wood in that personally I've never had to repair a cruciate myself. So, but that's what I've seen in my lines, and it's changed my method of selling puppies.
Hey, I'll ask
6
her
months,
that.
6 months. I recently had a female very sick with a PIO, and I was at an emergency hospital. She was hospitalized up there. And in the room on the wall was the shot schedule for puppies and kittens. And at the last shot was written right there, make the 6-month appointment for the spay-neuter.
Scary.
And this is what most vets are telling their owners to do now, neuter at 6 months. And I think that's entirely too early for a male Newfoundland.
As each, I was going to do a follow-up question, but what I'll do is I'll just add that to the question that was asked. At what age do you recommend your pet buyers spay or neuter?
I think spaying's a different ballgame. I personally don't think that there's any age that you really need to neuter a male Newfoundland. This isn't a breed that's Rottweilers, that they're aggressive or anything. My owners fence their dogs. They're not running loose. They're not going to populate the world. And I don't see, maybe there's a specific reason down the road. Vets will tell you about prostate cancer. Prostate cancer is more prevalent in neutered dogs than in non-neutered dogs. That's the other part of the research that I was just recently sent.
Thanks. Marg, cruciates and age for spaying and neutering.
Well, we've been hit with a rash of cruciate ligament ruptures just since 2004. We brought in a new bloodline, and he did sire quite a few, but he may have just arrived on the scene whenever it was happening started to happen. It's almost like it's an environmental problem that I can't figure out what that might be. I've been looking into it, and if the tibia plateau angle is higher than 26 degrees, your chances are more and more likely to have a ruptured cruciate. And if these dogs are neutered young, their chances of having a tibia plateau angle in the 30s is very good, and really does predispose them to rupture the cruciates. The testosterone level in a male starts to rise around 9 months, and it reaches its peak at 13 months and then drops off again, and that's that. I mean, he's a male now, and I think if you don't neuter before 12 or 13 months, you're probably okay on the males. But some of these bitches are getting ruptured cruciates too, and I'm at my wit's end to know what's going on here. I went and had my dog's tibia plateaus x-rayed, and they're in the normal range, and yet some of them have produced cruciates just recently. And up until 2004, we'd had 6 since 1965. Since then, we've had a rash of them. And it's, I'm treating it like it's a genetic problem because I don't know what else to do. Measuring the tibia plateau angles didn't work. I thought maybe it might. Maybe I had, inadvertently bred 2 high-angled dogs together, but that wasn't so. So I don't know.
Betty?
I've never heard before any relationship between neutering an animal and cruciates. I will say that I do think there's a genetic basis for it. In my experience, most dogs that have cruciate tears have good hips. All of them that I've ever had have had good hips. So we shouldn't stop breeding for good hips. But I think we heard at the meeting the other night that we are putting NCA money towards a study, or hopefully to get a DNA marker on cruciates. So somebody thinks there's a genetic basis. I really do feel it in my line that I've seen one half go and never get them, and another line that I'm working with get it generation after generation. And these are expensive things, and you don't want to sell this to people.
Peggy?
I think it's on the uprise. I don't think it's new, though. I think the diagnosis of it is getting better, but I think we've had it for years, and they've been undiagnosed or diagnosed improperly. I feel it's got a genetic basis. I'm interested in what Suzanne said about the hormones, but I know many intact males that are into their old age that are also collecting and having cruciates, as well as bitches. A lot of Newfoundlands, and the orthopedic surgeons will attest to this all over the world, are overweight. And that does not help their knees. It's not a friendly joint. The hip joint is much friendlier than the knee joint. And with an overweight dog that's out of condition, you're more likely to see these cruciates coming up. So I don't know what we do about it except try to get a marker, because that would be great, because it's coming up an awful lot lately. And I think I've seen it in all bloodlines that I've dealt with.
Kathy?
I definitely think we're hearing more about cruciate problems than we were in the past, but I think in thinking about it, that it's probably a multifaceted issue. Obviously, there's some genetic predisposition to it. I think that Peggy had a good point with the overweight dogs that are not in good condition, which is kind of a reflection of society today. I think 20 years ago, when you sold a pet to a family and the dog went to the family, the kids were outside playing ball, and the dog was with the kids, and they went to the park, and they went into the soccer games, and they went camping, and the dog was going. And I see more often, and I'm famous for my fat dog lecture, but I have more puppy buyers come to me to visit or have me see their puppies, and the puppies are obese. Despite all the warnings and the discussion about feeding, they are overweight and under-muscled. And as Peggy said, the knee is a very unfriendly joint. And when you have a fat, soft dog, and Saturday, it's a sunny day, and the kids say, let's go to the dog park. Okay, so fat, soft dog goes off to the dog park, runs with the other dogs, plays ball, and boom, blew out a knee. So I think it's a multifaceted problem, and I think it's going to take several different approaches to try to fix the problem.
Okay, Ron, I have a question.
I want to make
okay.
more comment too, because I think it's a huge problem for all of us. And I think it was the University of Colorado that published a paper a year or so ago saying they've found a genetic component to it. Finding a marker it would be a next step. But I do think there are a lot of facets and a lot of things involved. And I do think condition has a lot to do with it too, and the angle. They're talking more and more about this angle. I think where I was coming from is the fact that these neutered dogs have that angle that puts them at risk. I do have to say that in my history, I think my puppy people keep their dogs in better shape now than they did years ago. When I got into this breed, if you went to a dog show, they were hog fat. I think by and large, most of them, I still have the ones that come back and I yell at on a fairly regular basis, but I think I try to pound it into them, the weight issue. And there are a lot of components, but I think it's the #1 surgery we're doing in this breed now.
Okay.
And most of the calls that I've gotten on my own puppies, I said, are you having the surgery done right away? Well, not right away, because the vet says the puppy needs to lose 40 pounds. So, and they won't do their surgery on it because they want it to be successful, and it's not going to be successful on a puppy or a young adult that weighs 40 pounds too much. So they have to lose the weight first and then have the surgery. So I think that the weight of these newfies does hamper them with these cruciates for sure.
Betty, you had another comment?
I was talking to Clyde Dunphy before he left today, and he was telling me where does he live in Illinois, but we're nearby. One of the universities is coming up with a new, better operation, cheaper than TPLO, and they feel much better. He said they've done maybe, I don't know how many experimental ones, and vets are going to this hospital. Maybe it's Missouri, something. So, of course, we still got the problem, but
Cubs has a new one that they're doing.
Yeah.
I was just told that today.
I mean, the TPLO is outrageous, but this is supposed to be better and less expensive, so.
Marg?
I'm trying to think of the name of it.
The strange thing that's happening, these dogs aren't stepping in holes or getting bumped. Some of these dogs are spontaneously rupturing the cruciates. When they go in there, the ligament is either gone or is a gelatinous mass. And maybe there's a dog that was a big winning dog. He had several bested shows, and he showed very well on Saturday and Sunday. Monday was a holiday. There was a show that day too. Sunday night he seemed a little lame, and by Monday his cruciate was gone and he couldn't show. And yet he was fine the other 2 days, and when they took him in, the ligament was gone, and within 10 days the other one was gone, dissolved. And I was wondering why the vets couldn't, if there was any bit of that tissue, couldn't they stain that and look at it and see if there's something abnormal? But they said, well, who's going to pay for that? And it takes so many hours, and I was wanting them to maybe do that. And then if they had one who ruptured through an accident, compare the two cruciates. But they weren't much interested in doing that, and they said, who's going to pay for that? And it would be hundreds and hundreds of dollars, which I didn't have to do. And this, by the way, this tibia plateau angle, you cannot see that from the outside. It's not at all with a straight stifle or over angle stifle. It's an angle inside that you must x-ray to see it. Years ago, we had straight dogs, straight cruciates, and I was always worried that they might rupture the cruciates, but they didn't. They straight stifles, they didn't. We didn't have any ruptured cruciates for those dogs with straights. Now I've got better angles, and in those last few years, here we are. So there's something very strange going on, and I'm racking my brains. I'm going to treat it genetically because I don't know what else to do. But I wish somebody could maybe do some studies on these ligaments to see what on earth is going on and why are they dissolving like that.
Okay, thanks. I have a question down here in front.
Bill Colacci from Berlin, Mass. My question is, aside from the things that we normally test for, the hearts, the hips, the x-rays that we do preventive testing for in the lines, are there any things that if you saw them in the parentage or the siblings of the parents, you would want to take that out of the breeding pool? Environmental allergies or late onset diseases that I believe would be genetically linked. but that aren't tested for, so to speak, like Addison's or something.
What? I think Marg does. Suzanne, you were the last one to start, weren't you? Yeah. Yeah.
Oh, boy.
Good luck.
Well, certainly allergies, you don't want to have anything to do with those. Hypothyroidism is another, well, I guess you can have the test done. The first dogs I started out with were hypothyroid, and they had reproductive problems. And I just avoided that with the plague. I never, ever had anything to do with a dog that I suspected was hypothyroid after that, and we've been fine. But and I've steered right away from allergies, and we've done very well by not having that. I don't know. Must check back in your backgrounds and your pedigrees to see if there's anything lurking there that you don't want to bring in. Things you wouldn't test for.
Okay. Betty?
Well, yeah, we ran into epilepsy years ago, and of course you can't test for that, and I inadvertently brought it in twice, and it acted like a simple recessive, and then I had it. Like the second male and female, my brother and sister I brought in when they were bred with progeny of the first dog I brought in, then I had it. And it took me years and years and years to breed that out. And the only reason I could is because I knew exactly where I'd brought it in, and I was able to identify my clear dogs and my carrier dogs, and my, of course, I had several epileptic dogs they went to, but finally got to a point where I'm down probably less than 5% chance of them being carriers now, and we haven't had any epilepsy since I found out where it came from. But that's hard work, so you need to read deep research into the backgrounds when you're starting up, and find out as much as you can.
Okay, Betty?
I think allergies are the worst thing you can sell to somebody. It's a dog that's got skin problems, because you just usually don't clear them up. And then certainly temperament. I would never breed a dog with a poor temperament. And I can think it could be genetic. We can make excuses for them, but in most cases there's something there, and I just wouldn't take a chance on that.
Peggy?
As I understand it, these are things that show up later than the normal testing that you do on puppies.
Yeah, so they show up,
Yeah, like allergy.
5-year-old dog.
Yeah, allergies are certainly something that would plague a family as well as any other disease that would be life-threatening, because some of these things just can't be solved, and they spend thousands and thousands of dollars trying to cure something that's not curable. Temperament goes without saying. If that comes up, you've got to eliminate it. And I think any identifiable disease, if it came up like a disease like Addison's, if you had an Addisonian dog come into your program, you'd eliminate it. If you had Cushing's come into your program, you'd eliminate it. These are things you can't count on. They're not so common in the breed. Epilepsy certainly comes up later, and without a question, you would not deal with a dog with that. So I think those things are all things that are just common sense things that come along, and you want to remove that from your gene pool because you don't want to continue to produce stuff like that.
Kathy?
I agree. I can't add anything to that.
Okay.
I would agree also.
All right. Well, I'm going to exercise a prerogative here. As I've talked to breeders around the country in various breeds, one comment that I hear continually is, I'm never breeding outside the kennel again. Every time I breed outside the kennel, I get some terrible thing come into my breeding program. I'm really curious how you define line breeding, tight line inbreeding, and what your feelings are in terms of doing outcrosses or outbreedings. And whose turn is it? Betty's? Is it yours?
I guess so. I'm actually a very small breeder. I don't have many dogs, many Newfoundlands, so I can't stay within my kennel. I'm fortunate that people near me have good dogs to breed to, though. I think line breeding is the best way to go. But again, you're going to have to look at the dogs you have, and you don't have any perfect animals, so you've got to find something to cover the faults of the animal you have. I've never done an inbreeding. But I guess if they work, then you've got a very potent dog to carry on those wonderful qualities. But I would say that line breeding was the way I would like to go.
Peggy?
We do mostly line breeding. We've brought in dogs from all over the world to try to enhance the dogs in the United States. Some of them have worked out fantastic, and others have not. No rhyme, no reason. Some things click in when you go out, and some things don't. But you need to go out once in a while and bring in a little hybrid vigor to your own bloodlines. And I have no problem going out of the bloodline and trying something. It's just a roll of the dice sometimes. And if you see a nice dog that complements your animals that you have at home, why not bring it in and see if you can include it in the program? Sometimes it doesn't work, but it's very easy to blame it on the one you brought in.
Right.
But you contribute a little bit to it, too.
Okay. Kathy?
Oh, I agree. I do line breeding primarily. Over the years, I have outcrossed, and as Peggy has said, sometimes it works great, and sometimes not. And you have to look at a breeding program as you're you're traveling a road, and sometimes you take a turn and it's not the right turn. There's no guarantees. You're never 100% sure that bringing in a new bloodline is going to complement or not complement until you try it. And at some point with line breeding, you do have to go out and hope for the best, I guess.
I've basically line bred for years. I've done a couple of, years ago, I did some half-brother, half-sister breedings, which could be defined as inbreeding. They were very successful, but I didn't continue to do that with those animals. I've done very little outcrossing. More in recent years. I've done some outcrossing, and it's been fairly successful for me. But I basically look at my pedigrees and have been a line breeder most of the years.
Okay. Marg?
I've done a fair bit of inbreeding and was very successful with that, and I've done some line breeding. But I live in a fairly isolated area, and when I bred out, I got into trouble. And I'd have to, undo all the damage I'd done, and I'd wasted a whole year of her life. So my solution to that was collect and have 3 or 4 lines there. So at one point I had 30-some dogs. But I made good progress, and I didn't make mistakes because I knew all these dogs. I grew them up myself. I knew the things were wrong with them, and I was doing quite fine with that. And then I went out again and took in stud-feed puppies, and that's why I brought in my epilepsy twice. But now I'm down to very few dogs, and I have to go out. I can't keep 30 dogs anymore. So, yeah, I brought in some more stuff that I just as soon I hadn't.
Don't we all?
Yeah, so I've got to fix up that. But it's difficult when you don't know that you've got to know the dogs. And I'd like to see a male siblings before, and see them grow up and see the sire and the dam and know all about any dog I bring in. But you just can't when you live as far away from the main population of dogs as I do. So, yeah, it's difficult.
Okay. I'm going to do 2 more questions. There's one over there, and then a lady back in the last row.
I'm Jenny Lengel, and I'm from Kentucky, and I have a question about OCD of the shoulders. How much you're seeing and whether or not that's something we need to start screening for.
Peggy's turn.
I have not had a problem with the OCD in the shoulder. It's more located in the fragmented coronoid process in the elbow that I find affects Newfoundlands more. I think in almost 40 years of owning and breeding Newfoundlands, I've had one dog with OCD in the shoulder, created it, and it cleared up.
Kathy?
I've never had anything with OCD in the shoulder. I've definitely seen some OCD in the elbows, and sometimes you can actually get them through it, but a lot of times surgical intervention is necessary.
Suzanne?
I've had no experience with OCD at all, so not a lot of help here.
Marg?
I've had no problems with OCD of the shoulders. We did do a study, though, on the united coronoid process in the elbows. I had 2 dogs that had both elbows so bad, the effect that they had to be surgically repaired, and one of the vets at the University of Saskatchewan took upon himself to breed these 2 together, and they did this twice. We had 16 puppies. Unfortunately, he had a great big, deeply bedded box stall, and they were raised there where they didn't have anything to jump off or bang themselves on, and every last one of those puppies was perfect. Hips, elbows, everything, shoulders. So it didn't look like it was terribly hereditary, and I figured I'd just better clean up my act and not let these puppies get bumped when they were growing.
I don't believe I've ever had OCD of the shoulder.
Hi, Devin Upping from Eastern Canada. I was quite intrigued by the gentleman who mentioned that he'd been to a symposium where it was said by apparently a veterinarian that breeders had the potential to eliminate 95% of all the genetic difficulties. I figured that's going to happen about the same time that Star Trek has a tricorder. We can pass over all those puppies the moment they're born and know every problem they're ever going to have in their lives. I've been involved with this breed all my life, and I think that the degree of genetic influence or influential factors for all the problems that we encounter over the lifetime of the dogs is just humongous. I've got 2 questions that really relate to the genetic influence that we have to deal with. And first of all, I wonder if any of the panel members have had much experience with pen-hip and what your thoughts are with respect to that, and also with the incidence of autoimmune disease and cancer, and the influence we can or cannot have genetically with that.
Well, regarding the question on pen-hip, I've never done it. We just have always done OFA.
No, I'm just interested in knowing what your thoughts are with respect to the incidence of autoimmune disease as it relates to the genetic side of things. You know, we get all kinds of theories from veterinarians and whatnot. We have some people apparently saying that they believe there's a genetic component to the predisposition of a dog to have an autoimmune problem. Others don't. I'm just interested in your views.
I think there's definitely a genetic link to a predisposition to autoimmune disease. Definitely. But there's a lot of factors that go into what triggers a dog to go into an autoimmune situation. And your question with cancer, I personally haven't had to deal with cancer in any of my Newfoundlands, so I can't give you any good information on that.
Okay.
Oh, first was pen-hip.
What's the question?
We're almost done, Jenny. Hang in there.
I have no experience with pen-hip whatsoever. I lost a dog to autoimmune, and it was horrific, and I hope I never have to experience that again. I have not, that's my only actual experience with it, but I have to agree that from what I hear, there is some kind of a genetic proponent to it, but finding the trigger that sets off the autoimmune, I think there are a lot of different things that can set that off. And what was something about cancer?
Cancer?
Oh, I lost an old dog to liver cancer. I have had some calls of people losing their dogs to osteosarcoma. I think we're probably seeing more of that. I haven't experienced it myself.
Okay. Marg, they have pen-hip in Canada?
Oh, yeah, there's a local vet has just started doing that. I haven't made use of it yet. Once I had a young bitch who got lost in a blizzard and went into an autoimmune, I don't know what you call it, after that, and we brought her back out and she was fine and went on and had many litters, but the shock of being lost and being so cold, and she was only about 7 months old. The only way I found her was that the other dogs that had come back, they'd gone off after coyotes. And when they came back, the snow was plastered on the right sides, and so I knew which way the wind was blowing, and I knew which way to go looking for her, and found her. Or if we hadn't, I guess she'd have frozen to death. But then she went into autoimmune after that. We've had a lot of cancer, and I really think it's environmental. Our neighbors are spraying insecticides and herbicides, and they by plane sometimes, and they turn even over our house, and it just drives me nuts. And also, the dogs don't stay on our own property when they're hunting gophers and so on. They go through the fences into some of those fields, and I'm thinking that's why we've had osteocarcinoma and other carcinomas as well. They're usually around 9, 10, sometimes 8.
Betty?
Pin hip, okay. I don't do it. I have not done it. I have reasons for not doing it because they were recommending that we keep our dogs, that we can keep them till 4 months and then we can do it and then we know what we have. But what do you do if you have a whole litter and at 4 months you do a pin hip and find out that half of them may be dysplastic in the future? Then what do you do with them? I mean, how can you sell them in good faith? I don't think it's good to keep a whole litter till they're 4 or 5 months old to do this. I think they're better off in their homes. I have been very pleased, or not pleased, but I've been doing x-rays ever since they started x-raying. And the few people I know that have gotten my dogs in pin hipped, the pin hips were good and the hips were good. So, and I think everyone wants to know at the end, not a pin hip number, but if the dog is cleared OFA. So I don't have that. I've had a couple dogs that have had bone cancer, and I probably produced more, but it's not a big thing. I'm thinking of dogs that have cancer. My goodness, look at the poor Berners. You know, none of them, very few live past 7. You know, so there certainly is a genetic something going on with the Berners. I don't know about Newfoundlands.
Okay. Peggy?
I've never done any pen hip x-rays. I find the OFA and the results that come from that to be very suitable. Cancer, I think, is a growing concern in all breeds. I think the Newfoundland is fairly lucky there so far. I have had a dog with liver cancer, but the dog also had Lyme's disease and had many other organs affected by that. I think the autoimmune, definitely there's a predisposition, and our dogs are being more and more challenged today than they've ever been. The amount of drugs that we use to medicate, to put top spot frontline on them for ticks once a month, the heartworm medicines, the inoculations, and a new one every month for a new disease or a new virus or whatever. The challenges are great, and I think the immune system can take just so much, and I think that we have to look at the dogs that we have and select for our breeding stock the dogs that can handle the environment today the best. And if you come up with an autoimmune problem, it's devastating, and I think they should be eliminated from the gene pool if you can do it. But see how they face the challenge. Good health in a Newfoundland today and getting them into ripe old age is not an easy task. And you've got to sit down and look at the big picture, not just a small percentage of just cancer versus autoimmune versus Cushing's versus hip dysplasia versus cruciates. It's a big picture that you've got to look at to get that big buddy of yours into old age. And I think everybody tries their best, and we've got to continue to do so. Keep track of the facts, not fiction.
Thanks, Kate. I want to thank Ron Horn for being the microphone handler and carrying on. I promised that we would stop by 10 o'clock. I've got 1 minute to get you out of here. I want to make a special attention again to Kathy McIver, because I want you to know this has been her dream, her vision, to have an experience like this. Kathy, it was fantastic. Okay. And panel, I'm sure I can say that everybody in here has learned something tonight. And what I want to thank you for is your openness and your honesty about talking about your breeding programs and about the issues and how you face them and how you handle them. Thank you very, very, very much.